We continue our conversation even from just yesterday, how the pandemic, COVID mandates are really hurting the workforce as some people are making the decision to come back, some who are not. Today's discussion, we've seen a survey now come out saying that nearly every nursing home in Texas is facing a workforce shortage. So joining us here to talk about that is George LeadingAge with LeadingAge of Texas. Thank you so much for the time. And what did this new study really reveal?
Well, we did a survey of our members and along with the Texas Healthcare Association, and we surveyed over 120 organizations representing about 210 nursing homes and 33 assisted living facilities in Texas. And what we found is that overall, the long-term care workforce has experienced a 12% decline since the start of the pandemic. And this is having a huge impact on operations, on admissions. I think 30% had to reduce admissions because they didn't have enough staff. And it also has an effect on quality of care, quality of living environments. I mean, it's not just nurses that we're talking about or CNAs, it's dining staff, it's maintenance staff, it's pretty much anyone who works in the field. So it's created a lot of problems.
And for the people that are living in those nursing facilities, if there's fewer staff around, there's fewer staff to look out for them. And the staff that are then overworked as well and have to jump from patient to patient, don't they?
Well, absolutely. And again, a lot of stress is put on the workers that remain. A lot of them have to work double shifts. A lot of places have had to go to staffing agencies and paid huge exorbitant rates to get staff just to fill positions temporarily. And getting a different person to take care of somebody in a facility every day or every week certainly has an effect. You want the same people taking care of your loved ones all the time so they kind of get to know them and can take much better care of them.
And quality is a huge concern. I can only imagine when you are down to the slim pickings of who you can get to come to your facilities, you only want the best, but the best comes with a price. So how are you able to balance that? Or is that just falling on the patients?
Well, it's, again, we're not the only field that's experiencing problems, as you've probably reported. All of healthcare is experiencing all kinds of shortages, and hospitality industry, you name it. So everyone's competing for workers. And so that makes the cost of staff much higher. And I mean, even in the survey that we did, we found that 70% of the respondents said they could not compete with other employers. 63%, almost 2 out of 3, had no applicants even. And so it's really it puts everyone in a bind. We need. I know the state is considering some relief funds for. They've got some money from the federal government, and we want to urge them to look at long-term care and all of healthcare really in terms of providing some sort of relief.
What about the issue of vaccine mandates? Because we've seen some numbers that in nursing homes and long-term care facilities, some of the staff is less than 50% vaccinated.
Yeah, I mean, I think it varies according to the facility, what part of the state they're in, et cetera. I think those rates have been steadily climbing. And I think most people or most facilities that have had mandates have found that they've lost less staff than they originally thought. But in a situation like we're in now, where you literally can't afford to lose even a few staff, it puts a huge burden on facilities to, how do you hold on to these valuable workers that they need to take care of their residents.
Absolutely. You all recently wrote a letter to the governor asking for $400 million of Texas's $16.7 billion share of the American Rescue Plan Act relief funding.
Correct.
How will that money help?
Well, some of it we think should go directly to the staff to, basically a bonus so that, keep them working in the field that they're in. Money for scholarships so that people who are in training to be nurses can actually get scholarships to pay for their education and enter the field. So those are just a couple of examples of ways that money can be used.
It takes a real special person to want to take care of those that need long-term care, the elderly.
Correct.
You just can't get just somebody off the street to do this. What kinds of people are you looking for?
Well, I mean, there are lots of caring people in the world. So we're looking for those people who have, a real affinity towards older people with disabilities. And, a lot of people take care of the loved ones at home. And we think that they exhibit already a lot of the traits necessary to be part of this field. So we just encourage anyone who has a caring soul, really wants to help others. And we have the people who are in long-term care, particularly the ones that have stayed. Those are the real heroes. Those are people who we have some members that have employees that have been there 20, 30, 40 years taking care of others. And it draws them a certain type of person to that profession, and we need more of them.
I think lastly, George, we did get some information about maybe some local openings here in North Texas. Could you expand on that?
Well, I know one of our members, Buckner Retirement Services, has the Ventana in Dallas. I know they're looking for positions. And again, it's not just nurses that they're looking for, it's all kinds of positions. If you have any sort of even accountants or maintenance staff or dining staff, cooks, anyone, and all of these folks really do have contact with residents and enrich their lives. So it's not just the direct caregivers, it's the whole community or campus that takes care of these older adults.